know from many of the horses that I work with, they have great power to heal themselves. We just have to, sometimes get out of the way, allow them to be in balance, put them in balance, and then watch them. And we can very quickly find out when they go out of balance and can put it back in.
Alternative therapies in horse care can spark curiosity or skepticism. But traditional Chinese veterinary medicine isn't just a passing trend. With roots in thousands of years of practice, it's helping modern vets see horses through a whole new lens. Today, we're joined by Dr. John Langlois, a veterinarian with over 40 years of experience, who now works exclusively with TCVM after witnessing its profound impact firsthand. From acupuncture and herbal medicine to bodywork and spinal manipulation, Dr. Langlois combines ancient wisdom with deep clinical insight to support horses in a more holistic way. In this episode, we explore how Dr. John Langlois went from traditional vet to TCVM convert, the core concepts of TCVM, including acupuncture and the 5 elements, real-world cases where TCVM helped when other treatments did not, how to know if your horse might benefit and where to start, and why this approach is less alternative and more complementary than you might think. Whether you're curious about trying acupuncture or just want to better understand your horse's behavior and well-being, this conversation offers grounded expert insight and a more expansive view of what's possible in equine care.
Dear Horse World, it's Dr. John Langlois.
Dr. John, welcome to the Dear Horse World podcast.
Thank you. Happy to be here.
I'm very excited to have you here to talk about traditional Chinese medicine for horses. So before we kind of dive in to the questions, because this is a No Stupid Questions episode, which I'm really excited about.
Cool.
So we have a lot of questions from our community and from the NF team to ask you about TCM. Let's give everyone a bit of a background on both yourself and how you got into TCM, or what you call, did you call it TVCM?
Well, it's TCVM, Traditional Chinese Veterinary Medicine, as opposed to Traditional Chinese Medicine, which is for people.
Okay, so you're a vet, and now you practice traditional Chinese veterinary medicine.
Correct.
How did that happen?
Well, it was interesting. Well, I graduated from school in 1981 from the University of Florida, from the veterinary school. And there was a gentleman that was in the class before me. And he said, as soon as I get out, I'm not going to be doing any of this stuff that I just learned. I'm just going to be doing acupuncture. And I looked at him and I said, boy, that's such a waste of all of that study time and all of that knowledge and all of that. And then years later, and I've always been interested in energy works. Even as a 20-year-old, I was conscious about that and did meditations and yogas and things. So energy work and work in the chakras was important for me. Mm-hmm. But once I got through veterinary school, I became a conventional practitioner, and I was for 25 years. So, but I was always had that as an interest. So I got an opportunity to work in Australia during their season because I was a bit of a reproductive specialist.
Okay.
So I would go down for the Southern Hemisphere and do their work at a stud, fantastic stud, one of the wealthiest and most prominent political people in all of Australia. So I had a beautiful place to be. Mm. And while I was there, I met a woman from, Scottish woman that taught at Murdoch University. And I said, I have 5 broodmares that have 25 years barren between them.
Oh.
No babies, no cycling, some of them and they want me to get them pregnant. I have 100 mares to get, so I need to do this very well. So I said, could you book me on some points? Mm-hmm. And she said, yes. So she showed me 5 points that are kind of in the rear end of the horse, and a electrostimulator, a little electrostimulator unit. And she said, put the points in here once a week, put your electrostimulator on and run them for, 15, 20 minutes. And I did. And long story short, every one of them got pregnant and every one of them foaled
Really?
So from that, I said, I don't know if you remember the movie. I don't know, maybe the audience may not have heard it, but When Harry Met Sally.
Yes.
Cool.
Yeah.
So I said, well, I've got to have more that like I'm having here. I got to have more of that. So
cool.
I went into China and I tried to find a course, and I signed up for a course at an agricultural college
in China.
And I found out that after they had sent me the paperwork and this and that they really didn't have a very good organized approach. They were going to wing it with me a bit.
Specifically with horses?
Horses.
Okay.
Only on horses. Yes. So I said, okay, will you teach me acupuncture? They said, yes, we will teach you acupuncture. And I call it Chinglish. The language was so horrible that I could not understand what they were saying half the time. And I felt like this wasn't going to be a good educational way of going.
Okay.
So I came back to the States and went about my merry way. And Dr. Shea, who is the owner and master at the Chi University, I met him and his family in Gainesville. And we became friends. We played ping pong. Amazing. And he beat me every time. And met his children, and so got to know them. And I would have now a greater interest in doing acupuncture. So I would give him all of my acupuncture cases. So I have a farm, and we say, okay, we got a reproductive case, or we've got a musculoskeletal case. And I would say, could you come do it? And he was associated with the University of Florida at the time. So he would bring...
As a DVM.
As a DVM. And he would come down and he would bring his crew. You know, there might be an intern and maybe a couple of students, and they'd come down and do the work.
Cool.
And got a very good following. He did excellent work. So it was a really nice complement to my practice. And then so we're moving along, but a lot of years go by. And I finally decide, hey, it's time for you to get your education formally. So in 2008, I joined the basic class in TCVM and was really, really yearning to do it. It was my time. So I took the basic class, really enjoyed it. I went on to take advanced classes. I actually went on to learn spinal manipulation and chiropractic.
Oh, wow.
I took all the herbal classes. I took the Tui-na classes, which maybe we'll mention is a form of Chinese medicine.
Yeah.
And and 3 years later, 2011, he asked me to teach. Are you ready to teach?
He is?
Dr. Shea.
Dr. Shea.
He said, would you like to teach one of the courses?
At the Chi University.
Right, at the Chi University and in the lab, which is, not getting up in front of the pulpit and talking, but it was more of, could you guide the students to learn the points? So I said, yes, I'm ready. And I did okay. I had to ask a lot of questions to the other instructors to say, is that right? Is that right? But finally got it right. And just went on and finally decided I wanted to even get more education. So I signed up for the master's degree. And that took me 3 years, and did my thesis work on foals that would come down from Kentucky, thoroughbred foals would come down from Kentucky. And as soon as they got here, 2 to 3 weeks, they would develop fever, cough, and lung abscesses. So that was a big problem to try and solve. So I designed an herbal to use as a prevention, as opposed to putting out the fire, which I prefer to do if we can. And it worked beautifully.
You prefer to do a preventative versus putting out the fire?
Yes. It's a much better approach.
Right.
Yeah. And we can talk about that, about the importance of getting them in balance and letting them do the work as opposed to paying me to do the work. So, so that worked very well. So I got my master's degree, and then a year and a half later, I was asked to be on the faculty. So I'm assistant professor there for the last 3 years or so.
Okay. So for everyone who's listening, let's explain that Chi University is a traditional Chinese veterinary medicine tertiary institution for veterinarians specifically. Yes.
All of the classes are designed for veterinarians that want to do continuing education. We do have 1 or 2 now classes for the veterinary technician, so that they can assist the TCVM practitioner in their practice in a good way.
Cool.
So that's available. But yes, we get asked a lot if people could come and just listen in on the classes, and that's not where its design is. However, We do a lot of work in laboratories because I'm more of a clinician.
Mm-hmm.
And so for me, it's about getting the medicine to do its work in the field.
Mm-hmm.
So we do a lot of laboratories in association with the classes. And we have pretty much 5 to 1, 5 students, which are all veterinarians, to 1 practitioner or TCVM instructor. And we go through and learn all the points. And while we're doing that, we speak of the clinical aspects of it, how, when, and why to use the needle. What are we doing? And how do we get the results that we would like to see? And so in that, there's a lot of volunteers that come from the local environment that bring their horses. And there's a waiting list to get on that because it's such a nice community share to be able to offer them. There's no cost to them to come. They just have to trailer their horse in, and then we offer them, based on their diagnosis, 30 days of a free herbal.
Yeah, that's an amazing offering.
Yeah, and they really, and it's so wonderful to see the horses come back, maybe a month later, 2 months, 3 months later. How are we doing? And we're doing great. That's why we're back here. So that's nice to see. But one of the things about traditional Chinese veterinary medicine is when we treat, we try to put them in balance. So when they're in balance, when we come back the next time, maybe there's something else that's gotten out of balance, or maybe we have peeled off a layer, and now here's the underlayer that wasn't there in the first time we saw.
Yes.
So we have to pay attention every time that we examine a horse. What do you see in the moment?
Okay, so before we dive into that,
okay, good.
I'm so excited because that's the juicy, and that's one of the juicy, exciting parts about this episode.
Yeah.
We have a lot of vets who listen to this podcast. So for those who are listening who might be curious and thinking, okay, Dr. John, if I'm a vet, how and what would I study? Because it says, so you talked about a couple things that you studied and you perfected. I think it would be really helpful for the listenership to hear a little bit about what a vet can study if they want to incorporate Chinese medicine into their practice.
Certainly. So the first thing that they would approach would be a basic class in acupuncture.
Okay.
And this involves 5 sessions. 2 of them are on site and 3 of them are online.
Okay.
So they happen over about a 5.5 month period.
Okay.
And in that class, they would learn theory.
Mm-hmm.
They would learn point location.
Mm-hmm.
They would have to demonstrate their knowledge in a testing format of, do you understand the points and do you understand the theory, and so on.
Cool.
They would have 20 questions to show me the points on the horse, and there would be 2.5 hour written exam. So that would give you not a certification in Chinese medicine, but it would give you the basic acupuncture. There's more that you have to do. You have to make a case study over 3 months, that you do a case and you present it. Mm-hmm. And I do a lot of mentoring with the students in helping them to get that right, so that, when they present it, it would be an approved state. Mm-hmm. And they also have to ride with a traditional Chinese practitioner for 32 hours. Or I think you could also take the advanced class, so that would give you that waiver of having to ride with a practitioner, cool. Even though I encourage them to ride with a practitioner.
And when you say ride, you mean like shadow?
Shadow.
Okay.
Yeah.
And you mentioned there's a couple things that you studied. So you studied acupuncture, but then you also studied, what's it called?
Herbal medicine.
Herbal medicine.
Right.
And?
Twina.
Twina.
Yep.
So what is Twina?
Okay, so let me just go back. The 5 disciplines of traditional Chinese medicine are acupuncture, herbal medicine, Twina, food therapy, and the third one is exercise, which is more in TCM. And just a quick share, when I did the master's degree, I was asked to do Qigong for 16 weeks, 30 minutes a day, and sign in, trying to get our energy in a good place. So I keep asking the horses to do their Tai Chi or Qigong, and they don't listen to me. So there's really 4 main ones that we do.
That's amazing.
And all those are important parts, integral parts, to be able to make TCVM effective.
Amazing. So there's the 5th component is kind of like it's almost like energetic fitness.
Correct.
That's amazing.
Yeah, and before each class, we have an hour that you can take Tai Chi or Qigong, depending on the day, and get ready for the day.
Wow. Talk about this is forward thinking stuff.
Yeah, when I mentioned to my students, I say, you that horse is going to pick up on your energy a lot better than you're going to pick up on theirs. So you be right, and then you have a much greater chance to be effective and have the horse tolerate what you're going to do for them.
Okay, so
with them
as a TCVM, you're looking for. So let's dive into the first juicy part of this episode. Mm-hmm. Okay, there are 5 elements that TCVM works with. What are those 5 elements?
Well, the 5 elements are wood, fire, earth, water, and metal. And what's interesting is probably going back to 400 AD, I believe. They started looking at nature and saying, wow, nature can provide us a lot of information. What are we looking at? What happens during all these times of the seasons? Because each one of these elements is seasonal. Mm-hmm. The wood element is in the spring. The fire element is in the summer. The earth element's in late summer. The metal element's in the fall. And the water element is in the winter. And additionally, these elements provide them with us a lot of information about maybe what their taste might be.
Yes.
Okay, the wood element likes sour. The fire element likes bitter. Earth element likes it sweet. The metal element, the water element prefers salty, and the metal element prefers pungent. Pungent. So I know, how does this equate to what the horses might like? And it does. If you study food therapy, all these food therapies have specific energies and tastes.
Really?
So if you have a specific horse with a specific element and you want to maximize that or give them the benefit of that, then having that understanding. So, and it goes even further. Even the emotions are found in the 5 elements, right? The wood horse can tend to be angry. The fire horse is joyful. The earth horse is, grounded, happy to take care of, good doers there. And so we look at all of these things. Some are in grief, some are in worry. The earth element is in worry. The metal element is in grief. The water element is in fear. So now we know that these elements might, and once we know what our horse is in that element, while we are expressing these things, we're able to say, okay, so I know what you're dealing with because of who you are.
Wow. Okay, wait, let's break it down, because I think everyone's going to be listening thinking what their horse is.
Yeah.
Okay, let's walk through, and that we can incorporate, so everyone should know, Dr. John has worked on Lady and Galano, and our listenership is quite familiar with my horses. I talk about them a lot.
Cool.
And immediately when you met them, and I was lucky enough to bring both Galano and Lady to the Chi University, and it's the most incredibly zen and grounded environment. Immediately, as soon as you walk on the campus,
it's a big family.
Oh, it's a lovely place to be. And immediately when I walked my mare into the arena, you were like, oh, okay, firewood. Okay, firewood. So let's talk through what you saw when you treated my mare, and then let's talk a little bit about those 2 elements, and then we can dive into the other ones, because I think this is really fascinating.
Yeah. So, and again, even further into those elements, horses express themselves with their elements. Let's say the wood element. These tend to want to be the winners. They are the competitors that like to do it, first off, happy doing it, and they want to be up front and do their best. Very, very important for them.
Okay.
So, and they tend to be the ones that, although I think this was not the case with your 2 horses, they tend to be the ones that are dominant in the field.
My mare is definitely, she can be, depending on the herd dynamic.
Right. And there is other things to consider, are they in their balance or are they out of balance?
Yeah.
So that we have to look at and say, okay, now I know why you're acting that way. So that wood element, if it's out of balance, it's going to be like a drunken person. It's going to be irritable. And we can talk about, what organs are associated in the wood. The liver is associated. But back to your horse, that's what I saw.
Yeah.
And I was a little surprised because traditionally when we're needling, and we like to try to screen our horses that come for the beginning students.
Yes.
that they're tolerant of needles.
Yes.
Because if they're not, it's not a good learning environment to be chasing them around.
No.
So I thought your horse fooled me a little bit because I thought she was going to say, no, Dr.
Yeah.
John, you might get 4 or 5 in, but that's all you'll get.
Yeah.
And she was delightful with it.
She loved it.
And we were, if you remember, we were able to put probably 7, 8, 9 needles in and around her eyes.
Yes, we were.
Because that's a concern for her. So,
Yes.
and she was great with it. So that's a blessing when
She took a full-on needle nap. as they say.
yes. And then she went into the zone, which we love to see them there.
Yeah.
Yes. So, and I felt, you know, we look at the energetics of the horse, you know, what, do they have a good energy or are they a little bit weak in their energy? And we can talk some more about that. But that's an important aspect of them, you know, how are they going to be able to do with this process? And if their energy is good and their mind is good, and the way we tell their mind is good is we look at their eyes. Are they sharp in their eye? Are they very bright and alert? Are they conscious of where you are and other things? You know, some can take a nap, that's fine, but we still look in that eye to know that they're Shen. And if the Shen is good, the mind is good, then our healing is going to be good.
What is Shen?
Shen is a term for the mind.
The mind.
Right. And speaking of those elements, fire is controlled by the heart. Okay. So when the heart is out of balance, what do we see? Shen disturbance, a mind disturbance. They're anxious. They're can't settle down. They're like, maybe they go to the show, they're fine at home, they get to the show and they're like a mess.
Yes.
Well, that's a Shen disturbance.
Okay.
And that's a form. And that disturbance, and we can go into that again too, maybe because there's an excess in the body or maybe because there's a deficiency in the body. That's part of our 8 principles to look at because that's important for us to know, hey, are you have too much of something or not enough? So that fire element there controls the mind.
So fire horses are often, and what's interesting is you actually diagnosed Lady as both wood and firewood.
Correct.
So there are horses that can be a combination of 2 elements.
No, they're a combination of 5 elements. It's what's predominant at the time.
Okay.
So we're looking to see what's expressing because it can change, right? We get a different pattern, a different imbalance going on the body, and they go, wow, look at that. She's acting totally out of character. That's not normally her.
Okay.
Or she may be acting fearful. She may be acting, you know, other ways. So
Yes.
we have to each time take that look, see where they are, and remind me. I want to talk to you about when we actually go to look at your horse, and we may have discussed this, how we approach that. There's 4 things that we look at first. First thing is the inquiry. I want to ask you question after question after question when I'm trying to figure out what's going on with her. All those questions. So, okay, how is she with you?
Yes.
Who's in charge? Are you know, who gives the cue and who does the receiving? And
Yes.
do you work together? And how is she with her pasture mates? Does she have any imbalances? Itchiness, diarrhea, colic, coughing. All of those things have to be brought out so that we know. And then again, most important thing that I tell my students is, why did you bring your horse? And you said, well, I'm worried about her eyes.
Yes.
So that's where our focus was.
So then there are 3 other elements.
Oh, 3 other elements or 3 other things that we do.
Yeah, well, both actually.
Okay, so there's the inquiry.
Yeah.
And then there is observation. So when I'm doing a horse, I usually stand back. Don't engage them at all. I stand back and I watch them. So that's our observation. How are they relating to you? How are they relating to the environment or maybe other horses in the room? How are they posturing? Are they standing square or are they cattywampus? That's a medical term. Not standing correct.
Okay.
You know, and maybe look at the overall quality of their skin from a distance, overlook at their muscle mass. You know, do we see tension lines in the neck? Do we see whatever we're looking for can be done just by observation? And then the next is palpation. So we have to touch the horse.
Okay.
So I go through a pretty detailed examination of them. And that palpation also includes looking at the tongue pulse and going through the scan. So that's part of the touchy part.
And that is a similarity between TCM for humans and TCM for horses.
Correct.
Is that you do, when you go in to see a TCM as a human, and for anyone who's listening or watching, if you haven't, the first thing you do is you open your tongue.
Correct.
And they look at your tongue and then they check your pulse.
Sure.
So from a TCM point of view, what are you looking for? Because I was amazed that you were able to actually really get a good look at both my horses' tongues,
Mm-hmm.
and you're taking their pulse.
Right.
So what are you looking and feeling for when you do that?
Okay, so, and we're going to keep going back to the 5 elements because that's an important aspect. So all 5 of the elements open up into the face.
Really?
Yes. So
into the horse's face.
Correct. Mostly into the mouth. Okay.
Wow.
So actually all of them in the mouth, but there's some other aspects that we can talk about. But in the tongue, if you look at the tip of the tongue,
Mm-hmm.
that reflects the heart organ. The side of the tongue, and we'll see this sometimes, it'll be quivery, or you'll find some little red strawberries on the sides. That's the liver part of the.
Whoa.
So now we got all of these 5 elements, the top part,
Mm-hmm.
Kidney, and so on and so forth. So we can look at all of those things to say, okay, let's support where our problems are.
Mm-hmm.
If we have that tip of the tongue and we have a horse that doesn't want to go to the show,
Mm-hmm.
well, that just gives you more power to understand that her imbalances are related to the heart.
Mm.
And that's where our focus is going to be.
Cool.
So, and yet all of the elements also open into the other parts of the body. So the liver element opens into the eye.
Okay.
So, and when we talked about your horse, we said the liver is a very important part
Very
of our
important
treatment.
organ for her. Yeah.
In fact, the herbal that I gave to you was for liver yin deficiency. So that's where we want to go. So if the eyes are imbalanced, most of the time the liver is involved. The earth elements is spleen, stomach, that opens into the muscles or controls the muscles. The lung controls the skin, the surface of the skin, and that's where we have to have strong so they don't get exposed, or not exposed, but available to external pathogens. Like when they get wind, would be hives, right? So the wind comes in, they get hivey, and then they get itchy.
Yeah.
So that's control the lung element.
Whoa.
Yeah.
So if a horse had, because I've seen horses get all sorts of strange hives, eczema that they can't get rid of. So if you brought a horse like that, you would treat their lungs.
Yes.
Potentially.
Right. It's a little bit more complicated than that because there are a lot of relationships between the organs.
Mm-hmm.
So the lung and large intestine are like what we call husband and wife. So they're teammates.
Okay.
So, and we actually have in the large intestine channel or the lung channel, we have one point that marries them.
Beautiful.
And so let's say we have the lung is in deficiency, right? It's coughing, can't breathe very well. Well, we want to pull from the large intestine channel, which might be vibrant, and bring that over as a support team for husband supporting the wife.
Mm-hmm.
So all the 5 elements have that aspect of them that we want to do. So yes, in general, I'm going to focus on the lung. And if it's we got OCD lesions or any arthritis going on, that's the water element. That's the kidney. So we want to focus on the kidney because kidney governs bone.
Oh.
So that's all the things we look at, and that helps us to establish the proper diagnosis. If I've got a horse that is a little bit warm
Mm-hmm.
and he has arthritis in his knees and his hocks, which this
Mm-hmm.
particular horse that I worked on did,
Mm-hmm.
well, he has a kidney yin deficiency. He doesn't have enough air conditioner, right? So he's a kidney yin. So there's my diagnosis. Treatment's easy if I got the diagnosis right.
Cool.
And I can pick my herb correctly because I got the diagnosis right.
And that, I remember when we first met, you spoke very, very clearly about the importance of an accurate diagnosis.
Yes, and you can see it for yourself. If you went to the hospital and they didn't get the diagnosis right, you would be like, what?
Yeah.
Everything flows from that.
So let's actually talk a little bit about, so you were able to really recognize the elements that were present in my mare.
Mm-hmm.
And then you had a look at my gelding, Golano.
Yeah.
And I mentioned, we went through the observation and also the back and forth about, why are we here? So he was coughing, and he has been coughing since we got to Florida. a little bit low energy, and a little bit on the cooler side. So what did you find when you had a look at him? And this was, and we should also tell everybody what happened, because you had one horse that you did the permission point, and she was like, yeah, doc, like, do me, I'm ready. You did the permission point with Galano, and he was like, absolutely not. No, thank you.
No, and that's why we call it a permission point. Is I want you to say that it's okay to put needles in you, because it's insulting in a sense, right? So I want to make sure that you're okay with it. And I did the one needle, and the little bit of fire came out of him.
Yeah,
right?
Sure did.
And that basically says, no, thank you. I don't want to do that, because typically I'll put another needle in. He won't like that even more, and he'll twitch and fritch and stomp, and that needle will be out. So on those cases, I approach them two-way. I kind of chuckle when I told you that Dr. Shea would say, oh, this must be herbal case. So we don't put needles in this horse.
Yes.
But I can also relax them a little bit, and I do it all the time because I feel like I can get perhaps 70, 80% of the effectiveness of my treatment, and I'll take that any day than not doing it. So I ask the owner, is it okay to relax? We don't have a show coming up, and that's not a problem.
Yeah.
I don't get them crazy drunk, but I just want to get their mind off of it so that they can let me do my work.
So when you say relax, you mean you sedate them.
Correct.
So that they can receive treatment.
Correct. And that's a dance between the owner or the trainer and myself. And if that's good, let's do it.
Yeah, totally. Okay, so let's talk about what you saw, because he's a metal horse.
Correct.
So what does that mean?
Well, we mentioned metal horse. Those tend to be a little bit aloof. And remember, we're all 5 elements. And
every horse is all 5 elements.
Correct. And just which ones are being predominant in the moment.
Okay.
And so with him, he just was a little bit more offity about me being there. And his history, which in the inquiry was that he's having coughing. Well, the cough is associated with the metal element. So the lung, it governs the metal element. I mean, the lung governs that aspect. So I knew that he was a metal horse. So that was, helpful for me.
Yeah.
And they're lovely. They're great competitors as well. And they're great organizers. And I remember we talked a little bit about that, because I find a lot of times these metal horses, I mean, they poop in the same place. They like their order. They like everything the same all day long.
They like routine.
Routine.
Yes.
And that's important to understand them, because if you keep taking them out of the routine, well, yeah, I might just be desensitizing to him, but you're not working with who he really is.
And that's what I found, that I found to be so rewarding in this process of understanding constitutionally what is present for my horses from a TCM point or TCVM point of view.
Correct.
Because it does actually give me a lot, as an owner, it does give me a lot of intel.
Yes.
About how to even make their environment and their life even more in balance.
Yes. And I think also we discussed the idea that sometimes when you look at a person and you look at their dog and the people look pretty similar.
Yes.
Well, that's often the same in the horse world. People tend to gravitate to be around or purchase or get involved with an animal, a horse of the same element as they are.
Which I thought was hilarious, because when you said that to me, when I brought Lady to you, and her and I often feel as though we are kindred spirits. Yeah. And when you said that she's of wood fire, or firewood, I thought that was really funny, because that is, the liver is my big organ in TCM. Yeah. So you find that you can observationally say that people often constitutionally, from a TCVM point of view, they match their horses often.
I see it all the time.
Really?
Yeah.
That's fascinating.
Yeah. And so one of the things that helps me to figure out also who they are is after I've done that inquiry that we talked about, and then even before I do any palpation, I stand next to them for a little bit to just see how they want to interact with me. I just center my energy, take some breaths, relax. And the time it takes them to interact with me gives me probably 80, 85% chance of knowing who their constitution is right there.
Really?
Yeah. Because what's the fire element going to do? Hi.
Yeah.
My name's Sally.
Yeah.
What's your name?
Be
what
curious,
are you going to be doing
inquisitive,
today? Yes,
yeah.
Right. Life of the party.
And wood?
The wood is fine. They're good until you maybe ask them to do something. And then they're like, no, don't do that. I didn't ask you to do it. And I don't know why you're doing it. But I'm telling you, I'm a little bit in charge of this. And I'll tell you that I don't really want you to do that.
Cool. What about water?
Water, they tend to be more, if they're out of balance, is fearful. So if I take my hand up real quick around their face, they'll go, what? So they'll express some fear or, yeah.
And what about earth?
Earth are, again, do me.
Do me?
Do me.
What does that mean?
That means I'm good.
Oh, do me.
Yes.
I thought you meant like do me, gloomy. Okay.
No.
Like go.
No, not
like,
do me.
Yeah.
Do
like
me.
do
Words.
me. Like let's do this.
Right.
Cool.
They tend to be, very much, and it's interesting to understand too, from a performance point, the earth element wants to please.
So
that's their nature.
They're the people pleasing horses.
Correct. And they will actually work into, what they're doing beyond a little bit of discomfort.
Yeah.
Because they're interested in pleasing you. And so they tend to be good doers. They tend to be a little heavy, only throw them this little bit of food and they're fine.
Okay.
But then when they're out of balance, they want to have problems with colic and diarrhea.
Okay.
And that's the spleen, stomach that controls that part.
And then what about metal?
Well, metal, again, is going to be from the lung, or what were we just
and you said they're often aloof.
Yes, aloof. Yeah. You're like, I don't care what you do, just go ahead and do it. But I'm watching you. They can get their dander up too. They can get, very mindful about, I don't know if I really want you to do a lot of that. But they typically, when you get there, they're just off in the distance and just in their own little space. And they're not necessarily that interested in who you are.
So I have a question, and this is a little bit off the cuff, but when I got into, and I shared a little bit when we met about my own personal TCM journey, and it's been an amazing asset to have as a human. Now, someone told me, and I'm curious if you know whether this is correct or not correct, but TCM is TCM is very old. How old is it? It's like
2,500 to 3,000 years.
Right. Now, someone shared with me, because there's also different types. There's Japanese acupuncture, there's Chinese acupuncture, there's electrode, Korean. So it's expanded as a media, or what would you call it, as a practice.
Yes.
But there was a time in which there were doctors within China that had to treat like the children of the emperor or people that they may not be able to actually physically touch. And so this is what incorporated the very large observational element to TCM, was how much information can I get by not actually touching this person, but really extracting as much information as I possibly can from observation.
Yes. I mean, a lot can be done. Ideally, it's better to be in there connected one-on-one, for sure. But also, not to change that a little bit, but one of the most important things way back 2,500 years ago, 3,000 years ago, was the horses, because those were used in combat. They had priority as far as treatment goes. So they were very well cared for. Really? Yes. Because they had to be good for battle. And there's a lot of battling going on through the ages.
Oh, yeah.
So that was a very important.
So are you saying that 2,500 years ago?
Equine was very important.
So were they practicing
Absolutely.
Traditional Chinese medicine with horses?
Absolutely.
Really?
Yes. It's actually 3,000 years ago. And we have literature to support that.
Because that was one of my questions in this episode was, how old?
It's old.
Is TCM for horses?
Yeah, it's almost as old as TCM for people.
Okay, because this is very interesting, and I think this is one big massive myth that has been busted in this episode. In this season of the podcast, was talking with different, and Jochen Schlese talks about this in the saddle fitting episode. I even talked about this with Martin Black. So when we had the cavalry, and when men in wartime were responsible for horses in which they went to battle with. They actually had a much higher average knowledge base about how to care for their horses because it was an important component to their life.
Exactly.
So there is, I think, a misconception in the 21st century that horse husbandry or horse care was primitive 100, 200, 2,000 years ago.
Not at all.
Do you think that's true?
No, I don't. I mean, it was a little different, but I find it fascinating to know that many of the anatomical aspects of the horse, the neurologic aspects of the horse, they didn't have any idea what was going on, but they knew energetically. So even though they couldn't talk about, that particular neurologic problems in a conventional way,
sure,
they saw it energetically. So they go back to those elements and find those elements are out of balance. And there's a big difference, too, in depending on where they live, because in the southern part of China, anciently, they were very, very good on using herbals for the medicine. So the herbal was as important as anything than the needles. But in the northern part where the herbs didn't grow, they had to rely more on the acupuncture aspect.
Oh, wow.
And also something that went right along with this, and this is 2,500 years ago, Twina, which is the predecessor to modern chiropractic medicine.
Is Twina?
Twina.
Really?
Came out first. Then chiropractic came second.
Okay, so you have to tell everyone what Twina is.
Well, Twina is, and it's interesting, I teach this class at the Chi University, and oftentimes the question comes up and it says, well, how are you any different than just a regular old massage person? And I go, well, I do massage and I do these specific techniques, which there are many, but I do them to the principles of Chinese medicine. So once I have established a diagnosis, let's say we're working with the kidney, well, then I want to do these techniques that will reinforce or enhance the aspect of the kidney. So I'm going to do those there. And I find it fascinating, and I have to tell this story. I work with a lot of very high-powered horse farms.
Yes.
And they have very strong conventional veterinarians.
Yes.
That come in and they have a truck, maybe sometimes two, and they have their radiograph machine, they have their ultrasound machine, they have their shockwave, they have everything.
They have all their big machines.
Yes. And I walk in with a little box of needles in my hands. Low overhead, I promise you.
Yeah.
But I can accomplish so much. So, and I encourage the students to say, okay, learn these disciplines. Yes, acupuncture is wonderful, but what if you have a horse that won't tolerate the needles?
Right.
And I did have one horse who was a really top grade 1 winning thoroughbred that they called me. I hadn't worked with this gentleman once before. And he said, could you help him? And I said, sure. And he said, he can be a little bit rough, so be careful. I said, okay. So I went in, I tried to put a needle in. He was a butthead, excuse me. Didn't want me to do it.
He said, no, thank you.
No. So I spent 45 minutes doing Twina. And the trainer came back 15, 20 minutes and said, so you had to sedate him, huh? I said, no. He's just digging it. He's in the zone. Cool. It's amazing. And it's so wonderful to see the students when they come in. The first day they come to class, most of the day is done on them. They work on each other to see how does that technique feel on you, so that they can, take that on to the horse or the companion animals.
Oh, I love that.
And then they get out in the field and they have a horse, and there'll be 4 or 5 of them around. And when they get done, and what they see in the beginning, maybe a horse is painful over the back, or maybe the horse has got skin issues or whatever, but the results it's just fascinating to them because it happens right there in front. So, and then we go on to the idea too, which is not really TCVM, but it's taught at the Chi University, which is spinal manipulation, which actually is the correct term for it because chiropractic is done from a doctor of chiropractic medicine. So it's human term only.
Okay.
But we use it so often because when they say spinal manipulation, they're thinking, now what's he doing? It's just the same. It's just we call it different.
Okay.
So having that toolbox of acupuncture, herbal, Twina, chiropractic, food therapy, holy mackerel.
That's it's the whole picture.
It is. We can really, really put them together.
What does Twina translate into for English, you know?
Well, Tui-fa is push-pull.
Okay.
So it's a number of techniques. Some of the listening audience might be familiar with myofascial release.
Yes.
So one of the techniques is actually that doing, kind of lengthening, dividing the fascial planes underneath. But again, we're following channels. And one of the terms that we use in TCVM is stagnation.
Yes.
It's constantly used. And basically that says that the chi is not going from one point to another along the channel. So if it's not moving, it's stagnating. And that manifestation of the stagnation is pain, discomfort. So our goal is if we get it to go through, then we got a much happier system.
Amazing.
Yeah. So Twina is a beautiful, and guess what? I don't know. I found too many horses that didn't like it.
Really?
I can pound on them. I can do whatever technique I want to do. I can shake their limbs. I can rotate their limbs, their head. And they're all like, oh, that feels good.
That's amazing.
Yeah. So it's very rewarding in that light.
Whether we're deep in the Rocky Mountains or down in the heat of Florida, we trust YETI products on this journey of a lifetime. From the Rody 48 cooler to the YETI mugs you see right here in the studio, YETI coolers and drinkware are built tough, smooth, and ready for anything the horse world has in store for us. So I got two more questions before we dive into before we open the jar.
Okay.
You mentioned to me when I brought the horses to Chi University, you mentioned that you were you had completed a paper. Could you share a little bit with everyone about what that paper is on?
Yes. Well, it comes from the idea that, and you asked about training, what a veterinarian that came there, what they would do. So maybe a lot of veterinarians, they're maybe new graduates, they don't have the resources, they don't have the time. They're in that busy equine mode in the spring. I can't get out to do that class. So they don't get the opportunity. So what I did, and many of the practitioners in the area, the conventional practitioners have watched me and with the same owner and they say, well, he figured out it's this. How did he do that? And they want to understand, well, how did you figure that out? By going through the animal's channels and saying, okay, well, this is probably a hock problem with about 85% reliability. Because there's been at least 13 major papers done on this particular thing, scanning and associating with lameness conditions. So I wrote a paper for the conventional veterinarian to say, okay, here's where they are. Learn these. And I describe how to go through those and what the difference is when you get an animal that has a soreness. What is that? Is that an acupuncture point, or is that what we call an ashi point, a painful point, a trigger point, myofascial trigger point? So what is that? So that's what I go into in the paper. And I think it's quite informational, and I'm hoping the AAP sees it as valuable and I can come present it.
And so to add to that, what I think is really interesting that I really want to highlight in all the conversations that we've had that really stands out to me, and I think is really important, is traditional Chinese veterinary medicine isn't and I thought it really stood out to me when we first met. You said, I'm not fixing the horse. I'm putting the horse back into balance so that their body can do what it does best, which is to actually naturally heal. Correct.
And that's the whole premise of TCVM working, is that and we all know, maybe you know it from your own self and from others that you've met, and I know from many of the horses that I've worked with, they have great power to heal themselves. We just have to, sometimes get out of the way, allow them to be in balance, put them in balance, and then watch them. And we can very quickly find out when they go out of balance and can put it back in. But I remember one of my teachers said that one of her conditions of her working for this particular client was that I want to see you once a month. And that's not to put out the fires, but that's to keep that balance going. It may be a very simple few needles. It may be a change in the herb or whatever it is. then we don't, like I say, put out the fires all the time, that we're actually keeping them in good balance. And so I think the smart horse owner dances with their veterinarian in the light of, let's keep them in a good way before we have to do a lot of fancy treatment and expensive treatment.
And invasive.
Invasive.
So, and actually, before we dive in, one more question.
Mm-hmm.
What are some things that you find cause or initiate an imbalance?
Okay, well, we can bring that up in the context of you,
Okay.
Miss Liver. Okay, what the liver does not like is stress.
Yep.
So every horse that's in production is stressed, guaranteed.
Right.
If they're being put up for performance, they're in stress. They're not out in the back hanging out, grazing, playing with their buddies. We're asking them to do, and that's stressful to them.
Okay.
So if we're not paying attention, what happens is the stress causes the liver to be what we call stagnate. The energy doesn't move through the liver. That creates heat.
And I often feel it as it also creates anger.
Correct.
I felt
it does.
Yeah.
And that's why that wood element, you be careful when you're talking to them because they're going to punch you.
Yeah.
So that generates heat, and that heat comes through the stomach, and it creates heat in the lining of the stomach. So many of these horses that are liver horses that are stressed, they also have gastric ulcers, maybe colon ulcers.
Oh, wow.
The heat's coming through. Then the heat comes through and gets into the eyes. The eyes are red, just like a drunken man or woman.
And I've literally seen Lady, like I could describe to everybody in detail how this comes up.
Right.
In stressful situations, her eyes flare up.
Correct. So that's an example of what.
Or her stomach gets irritable. So
Correct.
you do the hind gut or the ulcer point.
Correct.
And she gets irritable.
Yeah. So that's just one example of, yes, what starts all of this problem. And I think that that's also something that a TCVM practitioner should aspire to and become good at, finding what is the root of the problem. And, I just came from a case this morning, and I'm going through the points, and I'm going, that hock is upset. Oh, the hip is upset. It's painful. 4 out of 5. The stifle is upset. Painful. 4 out of 5. The channels coming through there are all painful. What's going on? The root of the problem is the SI joint.
Oh, wow.
Because that's your center of rotation. So I said, we've got to fix that. Because me just doing all this other stuff is fine, but it's you're going to see me next week, and then the week after, and then the week after. It's good for the bottom line, but that's not the idea. It's about the horse. So we want to make sure that SI joint is correct.
And this is where the chiropractic comes in.
And also the conventional medicine. And that's one of the beauties about Dr. Shea at the Chi University, is that he tries to integrate those two in a big way.
Amazing.
That, and I have done that too. I said, there's conventional medicines has its strength, and TCVM has its strengths. And I have done, let's say that SI, I've kind of done deep needles, electroacupuncture, 30 minutes, 3 treatments. What is it, $600? And I get 25% improvement.
Wow.
That's not enough.
Yeah.
And if I'll have them injected, and the choice of injection doesn't necessarily always have to be a corticosteroid. It could be something else, homeopathic or other. But we've got to get that right. And I usually see 80%, 90% improvement. Then I can kind of keep them going. But so that's where the West meets East, and it does every day. And it's important.
So once you like me, once you maybe find out if your horse has a predisposition to certain elements, and like you said, and we'll emphasize in this episode, that horses are not one type. All horses have all elements in them.
Correct.
But I have seen certain conversation or certain literature that maybe suggests that certain horses are predisposed to certain elements. Is that true?
Yes.
So once you kind of know, are there things you can do? Like, so you described liver and you described firewood with Lady, certain things that will activate that liver. Once you know your horse's maybe predisposition to certain elements, can you also know what might activate those organs?
Absolutely.
Okay, so let's walk. I mean, like metal with Galano, what is common to activate the lung or the Was it lower intestine?
Large intestine.
Large intestine.
Yeah. So what we have to do, again, that most important thing is establish a diagnosis.
Yes.
Okay, let's say the problem is if you look at your horse and he's kind of running 102 temperature,
Yeah.
and he's coughing and his tongue is a little red and he feels a little warm.
Mm.
Well, what is that? Well, that's an excess heat.
Mm.
And that's bothering that lung.
Mm.
Okay. That's its source.
Yeah.
So we have specific points, acupuncture points along those channels that can release that heat,
Wow.
move the heat out. I think we might even.
We did that on
we
Lady.
did,
Yeah.
correct.
You had her bleed.
Yeah. So let's say we hear that cough, but there's no fever. Maybe there's no discharge. It's kind of a dry hacking cough,
Yeah.
maybe a little bit labored breathing.
Yeah.
Well, that's a deficiency.
Mm.
So we have to what we call tonify the lung. We have to give it more energy to be there to do its work.
Cool.
So we pick, again, we talked about marrying the large intestine to there, but
Yeah.
there's also tonification points in the lung channel that will help to build that qi.
Wow.
And that's one of the things that we do when we first do our exam. And we talked about tongue. We didn't really speak of pulse. The pulse also relates to all 5 of the organs.
Yes. Okay. Wait. Let's dive in there because we didn't get a chance to talk about pulse.
Right. So there, and if you go to a human TCM bookstore on pulses, the book is 1.5 inches thick.
Yes.
It's hugely important to be able to use that. It's available to us.
Mm.
So we use the carotid artery and we use the left side.
Mm-hmm.
We put 3 fingers on the left side on the carotid, 3 fingers on the right side. And those 6 fingers all follow the 6 organs.
Wow.
So we can do the heart and the liver and the lung and the spleen and the kidney. And so it's very, very informational to know. So if we have a pulse that's deep and weak, well, that usually reflects a deficiency, right?
Yes.
If it's bounding, get all out and pounding, that usually reflects an excess.
Yes.
So where is the excess? Well, we've done our inquiry.
Mm-hmm.
We've looked at her tongue. We've kind of felt like, oh, that left side in the heart position is really where it's weak, or in the kidney position on the other side. So we can take that as part of our complement to getting that diagnosis right.
Wow.
Yeah.
Okay. This is a great opportunity
Okay.
to break out the jar. Okay. Why don't you pick the first one? Okay. So the question asks, how do you explain TCM to a performance-focused trainer who just wants the horse to feel sound and win fast?
Well, I think it's a matter of understanding what TCVM is and what it can do. So, and we've talked about this before about the context of balance. If I go through a horse and what is the complaint? The horse is just not doing what they want to ask it to do.
Yeah.
Just not there with it all. And what can I do to get him to say, come on, let's do it correctly. Let's do it better. Let's do it best. So it's all that same, the answer is similar in a lot of ways, because if we allow that animal to feel good, look good by balancing with TCVM, moving energy out where it's sore. And we discussed this before about the idea that some of the constitutions really want to do it for you, even if they're not right. But when we put them right, they'll even want to do it better.
Wow.
Okay, and this is just one example from the racing world, right? We got a situation where the horse just doesn't want to come out of the gate very well. Does it just, says no, and now we're already behind. So, and it was winning its races. Now it's not.
Oh, interesting.
So what do? Do the TCVM exam.
Okay.
Severe stagnation over the hips. Stagnation is pain.
Yes.
Right? So I can say, okay, well, we can incorporate TCVM into that process by getting the energy to move through the hips, right? To using Twina techniques to get the energy to move through the hips. Using herbal, there's herbals that help that channel energy to move. Plus there's Twina techniques. There's also simple stretches that we can do, incorporate, that part.
Yep.
There's herbal liniments that we can do. And I can't tell you how many times I've had this situation where horses come off the track and come to me and say, won't get out of the gate because they're wood personalities or fire personalities that don't want to do it when they hurt. They just don't.
Yeah.
The earth one's going to say, I'm going to try, Mom. I will. I'll do my very best.
Yeah.
But these say, nah, ain't doing it.
Mm.
So they're just not going to. So I've had tremendous success getting them back and win.
Okay, next question.
Can you walk us through a case where a horse's behavioral issue, like tension or aggression, was actually rooted in a physical imbalance? Well, I can speak of that also fairly similar to how we approached the last question, because that's right in line with it. If they're painful, they have stagnation somewhere, that's a physical problem.
Yeah.
And those constitutions, the wood and the fire, are going to manifest it behaviorally, right? They're going to say no. And countless times I say, well, I did this and I'm going to show this horse how to do it. I'm going to teach it because I want this thing to do it.
Yes.
Well, you have to understand where the root of that problem is. You have to know where it is. And that's why, I spend a lot of time in what we call the AccuScan. And I run a workshop every year at conference. I have 40, 45 national, international veterinarians that come through. And we spend a day or 4 hours or 8 hours and do nothing but take a small little pen cap or a needle holder or something and go through all of these channels to say, okay, where is the source of imbalance? Cool. Oftentimes it's musculoskeletal, right? Mm-hmm. We don't see, okay, he's got a heart yin deficiency. No, maybe it's there, but he's painful. And there's specific channels that tend to hold this pain. They tend to be more towards the surface. So they're easy to get out if you know how. Mm-hmm. And so once we change that, the whole horse's attitude changes. I remember one, it was an Olympic caliber horse. And the rider said, every time I ask to engage this horse, he pins her ears and says no. And that's not her. So I go through and she has 4 ribs out. Oh, wow. They're not in the right place. Okay. And that's common. They can either be backwards or forwards or up. So I fixed her ribs and she said a few days later, that was amazing. Wow. And that's all it was.
And actually, in the previous question, I was thinking too, that in humans, I know a lot of women found TCM because traditional practices, they were trying to get pregnant. And traditional practices, traditional modalities wasn't working for them. And so often Western doctors will say, look, maybe you just go try TCM because we have seen it work. We can't tell you from a Western point of view, we can't tell you it'll guaranteed to work, but go try it. And then lo and behold, a lot of those women that I know conceive because their body is out of balance. So I think it's interesting when you think about explaining to maybe like a high performance coach or a high performance trainer with their horses. Well, if the Western, of injecting and maybe supplementing or even in some cases people drugging hasn't worked, then they might find themselves open to having the conversation about TCVM.
Well, I think it's wonderful, and you can probably appreciate this, that in 2025, we're in a much different world than we were 20 years ago.
Yes.
So it's in vogue, or not in vogue, but it's part of now of understanding the process of working with. And I'll share this case because this is a good one to help maybe complement or answer the question. But I had a broodmare. She had a baby at 4, very expensive mare, and had a baby. And then the next year, they didn't get pregnant. And then the next year, she didn't get pregnant. The next year, she didn't get pregnant. So, and she's at one of the finest reproductive clinics in Kentucky.
Wow.
Top guy. Very, very good veterinarian. And after the 3 years, he sent a letter to the owner and said, I have done everything that I know to do, and I still haven't gotten her pregnant. Maybe you should consider TCVM.
Interesting.
And so the client is mine of 42 years, 3 years. And so I got the horse back and took a look at her. What was going on? Red eyes, angry, did not want me to put a needle in her. Skin was not quite right, and she just wasn't in good balance. So I said, okay, I can do this. And I made the funny. I said, listen, I'm 73 years old, but I'm not too old to have a baby. So I worked on her 6 or 7 times, and lo and behold, we learned that she is 45 days pregnant.
Oh, wow.
So that's just an example that, yes. And one of the things that I enjoy about my practice now is that many of my calls are that very same thing. We're just not getting the results that we want from our Western approach, our conventional vet. Great guy, does so many good things for me, but this one's not doing like we want.
Right.
So we complement it.
There you go. Okay, next question. If someone listening feels stuck in a cycle of treat, wait, relapse with their horse, what's one question they should ask themselves today to take a new path forward?
Same old answer in the sense of getting to the root of the problem. And there's a number of disciplines out there that can be put to the watch to figure out why that's happening. Okay, because if you take could it be a chiropractic issue? Could it be a stagnation issue, a painful issue? Could it be an organ out of balance? Okay, what's going on? Many, many different things. And again, the horse is one microcosm. It's all connected.
Yes.
And so we have to understand those connections, that one thing over here will treat one thing over here. A lot of times I get the complaint, and the initial complaint I hear, and I don't even go right there. I want to go see what else is going on. Because I want to know what is the source of that. So having those multiple disciplines, and one thing I wanted to share in the context of the Chi is on their website, in their resource section throughout the country, they have Find a Vet. And in that, they have how they've been trained, TCVM wise at the Chi, how they had a chiropractic work done or spinal manipulation. Where are they? How far are they away from here? So yes, in a lot of the high end circles of performance, they already know where to find those people. But a lot of people don't find them very easily.
I've used that search engine on the Chi University website. Yeah. It's highly recommend it.
Excellent source to get started. And sometimes I say, well, let me know who they are, and I don't know all of the names. We've trained 10, 11,000 veterinarians, so
wow.
I don't know who that is, but I'll find out if that's one that maybe you should go right to.
What are like the potential sources of the problem? So you mentioned like chiropractic or biomechanical, could be an organ out, could be a deficiency or an excess of energy.
Correct.
So those, like, I think it's really helpful for whoever's listening and for everyone who's listening and for everyone who's watching. What is that checklist that you think about? Like it could be.
Right. Well, I'm going to go through and bottom line is getting that diagnosis. So in that checklist, I have to do the things that teach me to tell me what the horse is going through.
Yeah.
So I have to look at the horse, the overall balance of the horse. I have to do the tongue. I have to do the pulse. I have to do the accuscan. And I love it now more than ever, my ability to connect with the horse and spend time, because they will talk to you. I mean, all I got to need to go to an area and they'll let you know that that's an area that's kind of taboo because I got an issue there.
Yeah.
So I go through all that. So I'll go through and I'll do, I want to feel the horse. We have a lot of problems with heat here in Florida.
Yes.
So is this horse hot or warm or neutral or cool or cold? I want to know that because that's telling me a lot.
So that would be an imbalance.
Correct. That'd be an imbalance.
And then different areas of the body will tell you whether it's a particular organ or an area of the body that's seized.
Correct. We have the terms called middle jowl, upper jowl, and lower jowl. That refers to up in the chest area, the middle abdomen, and then the caudal abdomen, which is the over uterus, bladder, and those kind of things.
Okay.
So all through the horse's surface, those temperatures may be different based on what the horses experience. And we see this a lot in the older horses, the 15, 17-year-olds. You'll find you go along and they're pretty good here, and then you get to the back and it's cool. Well, that's usually a reflection of a kidney imbalance. So we're going to make sure that that's it. So that's part of my checklist. I want to feel everything and know what that is like in order to help put the whole understanding together.
Amazing. Okay, next question.
A lot of riders are frustrated with chronic issues that don't fully resolve. where you have seen TCVM succeed when other methods stalled. Let's see if I can come up with a good example, but I think that one of the things with TCVM that we have to appreciate is, and I understand this very well because as a Western practitioner for 25 years, I remember the trainer saying, let's get this fixed. I have things to do. This horse is performing. This horse is racing. I want this done. Mm-hmm. And so we use pharmaceuticals that are very fast acting. Unfortunately, they have side effects, and those are a concern. And what I have to educate the owner with TCVM is it takes a little longer to do. We can have some pretty dramatic results real quick, and that's one of the things that Dr. Shea said when we first saw you. He says, well, maybe you'll find something in an area in the hock and you put a couple of needles in and show them that it went away. And that's a really important part of our look is to say, okay, when I see it, that hock is bothering them. Well, if I put a couple of needles here, here, and here, and I come back and that's not bothering them, they don't have an issue in the hock structurally.
Yeah.
It's energetic.
Oh, interesting.
Correct. So if I move that through and that's no longer there, we don't have to do radiographs. We don't have to do injections. We don't have to do any of those things. It's just energetics. Move the energy, no pain, hock is better.
Okay. If that's not a motivator for everybody who's listening who spent thousands of dollars on injecting joints, I don't know what is.
Well, I can't tell you how many times, and I come across that where they say, we just once or twice a year inject the hocks and stifles. No, just do this medicine. You don't have to do that anymore. Whoa. Provided you're not seeing a big osteoarthritis and lesions and this and that. That's not going on. Mm-hmm. Well, you radiographed it and it looks good. Right. And so chronic issues are going to be more difficult. So patience is really required. And I think that, there has to be a little bit of not faith, but a little bit of interest to say, that I trust that the diagnosis is right. I trust that the medicine is right. I have to give it time. And sometimes we say, no, you need to rest this horse. You're just not going to get the results you want unless you give it a break for a reason.
Yeah.
So the chronic ones are more difficult, obviously.
Yeah.
So the longer the problem is there, the harder it is to get it right. But that doesn't stop me from giving it a good go.
Okay. All right. Whose turn is it to? I think
I
it's
don't
your
know,
turn.
but let's see what it says. We hear that herbs can help with ulcers, anxiety, stiffness. But how do you know which formula is right for your horse? And how do you avoid doing harm? That's a great question.
That is a great question.
So the first thing that comes to mind is that herbs are very powerful, strong medicine. They're not just take some herbs and see what happens. They have to be prescribed for a specific purpose. Can you cause more harms by giving them the wrong herb? Absolutely. So it takes a trained person that has gone through that process to understand the herb, the formula, as I mentioned in Jingtong, which is Dr. Shea's company. There's 6, 7, 8, 9 herbs in there that are all designed for a purpose. Some are the king herbs, some are the minister herbs, some are kind of helper herbs and harmonizers. So all of that together creates a very good possibility. So we're back to the basics again. If the diagnosis is right, the herbs I put, almost every horse goes on an herb. Not everyone, but almost. And Dr. Shea speaks of this and says that the acupuncture begins the process of balancing, the herbs finish it.
Oh, cool.
So what I do is typically I find out what that diagnosis is. I put them on the herb, which is, again, many 6, 7, 8 herbs, not just one, for their pattern. And one thing that I'll share is, let's say I have a horse that the owner has tested it for thyroid, for whatever, hypo, don't know. And they say, well, I want to get a supplement for that. I want to put it on levothyroxine. That should help. And I say, okay, but this is the case where traditional Chinese veterinary medicine is going to do far better than Western medicine. And the reason is, and I've done this many times to try and help convince, if you draw a level of the thyroid and it's low, and you put them on a supplement, let's say you put them on a supplement for 2 months, and you take them off the supplement, and then you retest them, they're still low.
Oh, really?
All you've done is supplemented it.
Right. It's like a Band-Aid.
Correct. And so in TCVM, I have 3 different herbals that I could potentially use on a horse that's hypothyroid to, depending on their pattern, do they have excess, do they have deficiency? We talked about that. And I'll do this and I'll put them on for 2 months and I'll retest them. Every time they're in the range between low and high. Maybe a little just above low, but maybe middle. But they've done the work. Because we gave them the chance to do the work.
Because the body can heal itself.
Exactly. Yeah, that's what makes it. And, and then there's other considerations. Okay, let's say the horse has EPM, right?
Yeah.
Well, you've got to get rid of that parasite.
Yeah.
And yes, you can support the animal's ability to do that. And there are some herbs. But what we like to say is use your Western medicine, get rid of that parasite, then balance the animal with the herbs and the TCVM. Then you're in good shape. So here's where that integration of Western and Eastern is very important.
Okay, next question. Let's say a client is curious but skeptical. What's the most practical, low-risk way to try TCM for their horse, and what kind of results might they notice first?
Well, typically what I ask them to say, okay, you've come to me because you're interested or you're curious to discuss what their concerns are, and then put them on a program and give them their expectations.
Right.
What do we expect to see? I usually try to do that in 1 month. And say, what did you see differently after a month's treatment? Maybe that's 3 acupuncture treatments. Maybe it's 1 acupuncture. Maybe it's a herbal for the month in complement with the acupuncture. What did we see? Did we get the results that we talked about, the expectation? And that's going on. We continue from there on a way. And again, part of the idea we speak of is this balancing. We used to have a situation with the thoroughbred that if they were a mother-to-be and they lost their baby, aborted it for whatever reason. And they say, well, next year I'm going to put it on Regimate, which is a progesterone supplement.
Right.
And then they go on and have a baby. Guess what happens? They're on that Regimate every time they have a baby. Why?
Right.
Because that confidence, that worked. That progesterone worked on this horse.
Right.
I never have to use that supplement. There's so many better ways to do. Although the one we mentioned earlier with the mare that didn't want to cycle in the spring. She wanted to cycle in the fall. Well, you can't breed a thoroughbred in the fall. You breed them in the spring. And if they're not cycling, we got to do something. Regimate's not going to do it. So the idea of using the herbs to put the animal in balance gives you what you want.
And I think that's such a great delineation often between Western medicine and Eastern medicine, which is Western medicine is really often a Band-Aid. Not always. And again, we don't speak in black and white on this podcast. I think what we try to really do is represent like the individual examples, the context, and all the gray in between. But I think what's so interesting in this, in hearing you speak is this medication being prescribed as a Band-Aid, meaning that horse will be dependent on it in order to maintain some semblance of balance or a healthy state? Or are we using different modalities or different herbs to then bring that horse back to a healthy state or a neutral place that their body can get them to naturally?
Exactly. And one of the things that I find is I'm very optimistic. And I try to give the owner or trainer, whoever I'm talking to, that optimism, and I'm asking it from them as well. So if we're going to get through this journey together, to try this for a month or 2 or 3, you need to trust it, try it, be positive about it. Your manifestation and, we're doing this, it's going to work.
Yeah.
Attitude.
Yeah.
No harm in that. It actually helps the whole process. So get on board with the possibilities.
Okay, next question. We only got a couple left.
What are the biggest myths you hear about acupuncture or herbal treatments? And what do people get wrong? Okay, so I can explain this as an example. We have certain horses, particularly in the thoroughbreds, that have some laryngeal dysfunction.
What's that mean?
The throat's not working right.
Oh.
They're not breathing right. You've heard of the roarers, right?
Yes.
So roarers, or they have displacement of their soft palate, or they have epiglottic entrapment. All these things are going on.
Mm-hmm.
And so one of the myths that I find is that say, okay, well, yeah, you do acupuncture, but it doesn't hold them. They're just going to go back to it.
Mm.
And I say, are you sure? Meaning, I've had many, many follow-ups on doing these things to correct the problem, okay? Mm-hmm. And I have to go back because I've had a lot of work with the thoroughbred. When you present a horse for a thoroughbred auction, these things have to work right. Those arytenoids have to open synchronously and all the way. Mm-hmm. Otherwise, it's not really good, because if this horse can't get its air, it's going to have a problem.
Yeah.
So, but I've had many follow-ups where that acupuncture has held for years.
Really?
Yes. So, but then there's the situation where what created the imbalance in the first place? Mm. So there's the myth that, oh yeah, I did some acupuncture, but it didn't work, or it worked for a little bit, but it didn't work for long. Mm. And that's because it's not just one-time deal. It's a witness of the horse and an examination of the horse over time to see. And I mentioned that to you, that I may see a horse for a month or two and come back, and the next time I see it, I change the whole plan for the horse. Yes. Because we peeled off a layer. So now we don't have a yin deficiency or no air conditioner. Now we've got not enough qi, not enough energy to do the job. Mm-hmm. So I'm going to change up what I do. So the myth is that, I guess, if I could say, is that it doesn't work.
Mm. I would also, do you feel like too, this is a little bit of a situation as well, that you have to also look at the responsibility of the environment, that both horse, like we say this both, in all aspects with humans and with horses, but like, you have to also ask, what's the environment in which your horse is going back to?
Sure. Because
TCM or TCVM can only do so much. If this horse is not in balance in their home, in their environment, in their care, in their stewardship, whatever environment they're in, then things might still come up, correct?
Yes, absolutely. So what is the root of the problem? Mm. We know the constitutions are predisposed. We know environmental conditions are predisposed. We get a lot of horses that come down from Canada up north, and they're here for a month and they can't sweat. They're miserable. They got skin disease. So they're now been put into another environment. So what do? Well, we have to manage them because they're here for a purpose.
Right.
And we have to put them in balance to overcome these things.
Yeah.
Or we make the recommendation, go on back home.
Yeah.
That doesn't always fly.
For someone who's used to conventional vet care, what are the early signs a horse might benefit from something like acupuncture or herbal support?
Well, that's a very broad question.
Yes.
If you don't have any exposure to TCVM and a practitioner and the benefits of it, the early signs typically are you're not getting the result that you would like to have from your approach. It can be for anything. It can be a musculoskeletal problem. It can be any organ problem. It can be a non-sweating problem. So
I've seen horses break out in like unbelievable bouts of eczema that no Western ointment or pill or treatment can treat.
Correct.
Until they do TCM.
Right.
And I mean, I'm talking like painful, scaly, bleedy eczema.
Absolutely.
And I remember the first time I saw that on a horse, I was like, I didn't even know horses could get eczema.
Right. And, that's the thing, is they have to, open up a little bit to possibilities. And what we find too, I love prevention. I have an herbal shampoo that we use, that we designed with nano copper technology, and it is a prevention for these things to happen. So is that TCVM? Yeah, it's Chinese herbs, it's Chilean herbs, essential oils, it's nano copper, all of these things, and that gets that animal to not that point of having major illnesses. And one of the things that TCVM looks at is what is the level of the problem?
Ooh.
So we have names for those things. The levels. Is it on the way side, which is on the surface? Is it on the qi side a little bit deeper? Is it on the yin side a little deeper? Or is it in the blood level like you described?
Wow.
So each treatment, each herbal preparation has to be designed to treat it on its level.
Right.
So if I'm treating, for a surface problem and he's bleeding, I'm not going to do very well. Got to get down deeper and harder.
God, I love that.
Yeah. And I've had many successes with particular skin problems like that. So I think the key is listen to the podcast, hear the possibilities, and then when you see a problem, say, hey, should I integrate something else with this?
On that note, I think we might even wrap up there because that's, I think, a beautiful prompt to then include the fact that we're going to do a follow-up episode with Dr. John Langlois. And we're going to, inviting everyone who's listening or watching this episode, if you have a specific case or you have you're challenged with something specific with your horse, or maybe you know of a horse, or maybe you have a horse in your program, or if you're a vet and you have a horse under your care that you feel might be a really strong TCVM case, write into the podcast. So you can get us at podcast@noelfloyd.com, and we'll include the link in the show notes. And you can please write in your case, write in the story. Don't spare any detail. Don't be concerned about length, because Dr. John is going to go over those cases and we're going to go over them in a follow-up episode.
Great.
And that is actually not my idea. It was John's idea.
Okay, cool.
And I think this is a really exciting opportunity to have a world-class TCVM, give everybody within the horse world, no matter where they're geographically located, an opportunity to maybe get some more intel and a more holistic look at a problem that they're facing with their horse.
Great.
Well, Dr. John Langlois, thank you so much for coming on the podcast.
Well, I thank you for inviting me, and it was a pleasure to meet you, and I'm looking forward to the future.
Thank you, YETI, for supporting us on this journey of a lifetime as we traverse the heart of the horse world.